मेरा नाम आकाश सिरमौर है। मैं छत्तीसगढ़ रायपुर ज़िला से आया हूँ। मेरे दादा श्री परशुराम सिरमौर जिनका उम्र 90 साल है, उनका बीटिंग हार्ट सर्जरी डॉक्टर सर प्रतीक भटनागर द्वारा किया गया और ये नामुमकिन था जो हुआ, और बिना हाथ बिना पैर में कट किए ये हो पाया। ये सर डॉक्टर प्रतीक भटनागर के द्वारा किया गया। और हमने सुना था कि डॉक्टर सर वर्ल्ड के बेस्ट डॉक्टर हैं और हैं भी, तो हम उनके पास आए और अच्छा सर्जरी उनके द्वारा किया गया। हम यहाँ इसलिए आए क्योंकि हमें पता चला कि सर बेस्ट सर्जन है ये सब के मामले में, और 90 साल की उम्र में ये सर्जरी होना नामुमकिन था। और आने से पहले दादाजी के सीने में बहुत दर्द हुआ करता था, जो अब सर्जरी के बाद बिल्कुल नहीं है। अब वो चल फिर भी सकते हैं। और हमें फैमिली मेम्बर के द्वारा पता चला सर के बारे में, तो हम यहाँ आए और बहुत अच्छा उनका ट्रीटमेंट रहा और बहुत ध्यान भी दिए वो, और आज ठीक है। और बाकी डॉक्टरों द्वारा तो मना ही कर दिया गया था कि नहीं हो सकता, बोले जो है चलने दीजिए, दवाई पे जैसा चल रहा है। तो सर बोले कि नहीं, हो जाएगा। प्रतीक भटनागर सर की जो टीम है वो बहुत अच्छी है, और जैसे ही जब से हम हॉस्पिटल में आए हैं तब से बहुत ध्यान रखा गया, हमारे दादाजी का भी और हमारा भी। हमेशा बात सुनते हैं, जो बोलो उनका मतलब जो भी प्रॉब्लम हो आप बताओ, भटनागर सर तक बात पहुंचती है। और भटनागर सर भी खुद मिलते हैं हमेशा और ध्यान रखते हैं, सभी टीम भी और सर भी। सर के द्वारा एक बहुत अच्छा गिफ्ट दिया गया है हमको भी, हमारे पूरे परिवार को। और मैं इनका श्री प्रतीक भटनागर सर जी का बहुत बहुत धन्यवाद करता हूँ, और उनकी पूरी टीम का धन्यवाद करता हूँ। और थैंक यू केयर हॉस्पिटल बंजारा हिल्स।
Hello everyone, I am Dr. Prateek Bhatnagar. I am the Director of Cardiac Surgery at Care Hospital Banjara Hills in Hyderabad. Today I am going to talk about a very interesting patient. We operated this 90 years, yes 90 years patient who came to us from Raipur in Chhattisgarh. He was having significant chest pain for the last 2 weeks and was having a lot of discomfort because of that. Now, because he was quite active in his life, he and his family members wanted a proper treatment for him. Coronary angiography showed that he had critical blocks in the coronary arteries that supply blood to the heart. He had critical left main coronary artery disease along with severe triple vessel disease, which basically means that he had very poor blood supply to all parts of the heart, and any time he could have had a major heart attack with life at risk. It is very appreciable that the patient himself and his family members wanted to give him a life which is full of activity and a good quality as long as he is in this beautiful world. So he accepted a bypass surgery, which was the only correct treatment option for him. We did his bypass surgery using the latest and the best technique of bypass surgery in this age, and that is beating heart surgery with total arterial revascularization using the Y graft. Now, Y graft is a technique of bypass surgery where we can do the entire surgery without touching the big vessel that comes out of the heart called the aorta. And by this technique, we can almost totally exclude the possibility of getting a brain stroke, which is the biggest cause of problem and risk in anybody who is elderly, that is more than 70 years of age. At 90 years, that is the biggest problem. Should the patient be all right? Would the patient be all right? Would the patient get a brain stroke? Would the patient get a paralysis or coma? These are the questions that a cardiac surgeon has to answer. And by giving the Y grafting technique, we can do the entire bypass surgery without touching the aorta and therefore totally excluding the possibility of stroke. Also, we did this surgery on the beating heart without open heart surgery, without cutting the heart, without stopping the heart. This again contributes significantly in preventing the risk of stroke. Also, we did the entire surgery without any cuts on the legs, and by making no cuts on the legs, we were able to give the patient arterial grafts only, and arterial grafts are the only grafts which can be used for this Y grafting technique. So, by this surgical technique of beating heart surgery using the Y graft, we were able to do the entire surgery on the beating heart without open heart surgery, and the patient in fact had an excellent recovery. Normally you will find that and we expect and we think that the patients who are old, they would be in bed for a long time, they won't be able to move out. But this gentleman was walking around within 48 hours of surgery, and he is taking his food normally. In fact, he started taking his tea and coffee within 20 hours of surgery. So he has had a very good recovery, and now that just 1 week is over, he is ready to go home, hale and hearty, and happy with Hyderabad and the hospital and the team of doctors, nurses, and all other paramedical staff who take care of him. Thank you.